Hello, learners. Welcome to Certificate course on organ transplant, nutrition, and health. This is your course instructor, Aisha Nasneena PN, and I'll be taking this course. So let's take a look on the modules and the contents of the course. Okay. The first module is Introduction to Organ Transplantation. Second, Nutrition in Kidney Transplantation. Then Nutrition in Liver Transplantation. The fourth module is Nutrition in Heart Transplantation. Then fifth module is Nutrition in Intestine Transplantation. Then sixth, Nutrition in Hand Transplantation. Seventh, Nutrition in Lung Transplantation. Eighth, Nutrition in Pancreas Transplantation. And ninth, nutrition in hematopoietic stem cell transplantation, that is bone marrow transplantation, and 10th, nutrition management after pediatric solid organ transplantation, and then post-transplantation complication, and the last module, that is 12th module, is case studies. So let's take a look on the course module contents of each modules. So module 1, that is Introduction to Organ Transplantation. First one is Introduction and Classification of Organ Transplantation. Then we will learn pre-transplant tests, then immunosuppressant medications and the side effects. Then there is drug-nutrient interactions, then nutritional screening and management in transplantation, and the last one, nutrition support following the transplantation. So this will be like an introduction to the entire organ transplantation topic. Next is module 2. Module 2 is nutrition in kidney transplantation. So first is chronic kidney disease, its etiology, classification, symptoms and diagnosis. Then there is types of dialysis and indications and contraindications. Then nutritional risk in kidney transplant patients. Then the preoperative nutritional recommendations and postoperative nutritional recommendations. And the dietary patterns in the transplant population. Post-transplant medications. Complications are also mentioned. Next is module 3. Module 3 is nutrition in liver transplantation. So this topic will be dealing on liver failure, etiology, classification, symptoms, diagnosis, and treatment. Then the metabolic disturbances in pre-transplant patients. What are the common metabolic disturbances they felt? Then indications and contraindications. Then the pre-operative nutritional recommendations, post-operative nutritional recommendations, and complications after liver transplantation. Then module 4, that is nutrition in heart transplantation. So the classification and different types of heart failure, then indications for heart transplantation, contraindications for heart transplantation, preoperative nutritional recommendations, post-operative nutritional recommendations, post-transplantation complications. Then is module 5. Module 5 is nutrition in intestine transplantation, that is intestinal failure, intestinal transplant modalities, indications for intestine transplantation, contraindications for intestine transplantation, preoperative nutritional recommendations, postoperative nutritional recommendation, and the transitional feeding after transplantation and post-transplantation complications. Next is nutrition in hand transplantation, that is module 6. So the topics are hand transplantation, the criteria and procedure, then the dietary recommendation after hand transplantation, and what are the complications that face after hand transplantation. Then module 7. Module 7 is nutrition in lung transplantation. So it is a the topic is lung transplantation introduction, indications for lung transplantation, contraindications for lung transplantation. So it's lung transplantation, then criteria for lung transplantation, post-operative nutritional recommendation, nutritional management after lung transplantation, dietary guidelines, specialized nutrition support, complications after lung transplantation. Next is module 8. Module 8 is nutrition in pancreas transplantation. So pancreas transplantation, introduction, types of transplantation and criteria for pancreas transplantation, then pancreatic kidney complex transplantation, islet cell transplantation, indications for pancreas transplantation, contraindications for pancreas transplantation, post-operative and pre-operative nutrition recommendation, complications after pancreas transplantation. Then there is module 9. Module 9 is nutrition in hematopoietic stem cell transplantation. So what is it will be dealt with what is hematopoietic stem cell transplantation, then the donor types of for HSCT, then procedure for HSCT, the indications for HSCT, then the nutrition management of hematological cancers undergoing hematopoietic stem cell transplant, the nutritional support during acute phase of HSCT, then the glutamine and nutrition support, then low microbial diet and dietary practices will be discussed in this module, then complications after the HSCT transplantation. Next is module 10. Module 10 is nutritional management after pediatric organ transplantation. So first it will be learning on nutrition assessment, then nutritional requirements, then nutrition recommendations for liver transplant recipients, and nutrition recommendation for kidney transplant recipients in children, then nutrition recommendations for heart transplant recipients, then nutrition and growth effects of immunosuppressive medications. Then module 11 will be post-transplantation complications, will be detailed learning on the what are the post-transplantation complications. So first is immunological basis of allograft rejection, and then we'll relearn what is allograft rejection, then graft versus host disease, then what is the nutritional management in graft versus host disease will be dealt, then long-term metabolic and nutritional consequences that we felt after transplantation. Then we'll deal on food safety guidelines that is commonly practiced after transplantation. Then module 12, which will be mainly comprised of case studies. So first one will be a case of, on liver transplant. Then case 2 will be on a pediatric kidney transplant. So that is the entire overview of this course. So let's take a look on each modules, and we'll see on the next chapter, that is module 1. Thank you.